my name is Jamie Charlebois and my pronouns are she, her. I'm a cisgendered white woman living in Barrie, and professionally I am an advanced practice nurse and psychotherapist working with pregnant and postpartum individuals and their families.
Hi, my name is Mark, and I am an obstetrician gynecologist working in downtown Toronto, and I'm really happy to be here speaking with you today.
My name is Kirsten Schmidt. I'm a registered midwife in Ontario and Quebec. I use the pronouns she and her, and I identify as queer. I've been in a queer relationship for the past 23 years. We have 3 kids, one who I gave birth to and 2 who we adopted.
My name's Gabrielle Griffith. I use they, them pronouns. I'm a parent, full spectrum doula, and reproductive justice advocate living in Ontario.
Hi, my name is Olivia Scobie, and I am a social work counselor in Ontario. And I specialize in supporting parents who are struggling with their perinatal mood, and I work a lot with the queer community in Ontario.
My name is Helena Frecker. My pronouns are she, her. I am a general obstetrician and gynecologist in Toronto. I have a special focus in my practice on the care of LGBTQ+ and gender diverse individuals. I provide gender affirming hysterectomies, care for trans women post vaginoplasty, and also provide reproductive and gynecologic health care, which encompasses a variety of different clinical concerns for LGBTQ and gender diverse people. I also provide obstetrical care, and I strive to provide an affirming and inclusive experience for my patients as they move through pregnancy, birth, and infant feeding.
For people to access healthcare of any type, but perinatal healthcare specifically, they need to feel safe and respected. It's really important. We know that people won't access healthcare if they're having any fears of being discriminated against, if they are concerned that their pronouns aren't going to be respected or their relationship isn't going to be respected. So in terms of being open and accessible as a healthcare provider, it's essential. Otherwise, we won't have people actually come to us for their care.
Accessing perinatal health care can be one of the most incredible, but also one of the most vulnerable and scary experiences a person can go through. People put their trust in us, not just for their physical safety and the safety of their unborn child, but for their psychological safety as well. And we know that LGBTQ+ and trans and gender diverse individuals have a disproportionately lower level of psychological safety in healthcare settings compared with the general population.
We know that this group has unique health and reproductive concerns that are often not adequately addressed by healthcare providers. And sometimes barriers such as lack of knowledge or continuing discrimination or violence can lead to health inequities such as higher rates of perinatal mood and anxiety disorder, higher levels of vulnerability from negative medical or health outcomes, and more complex and difficult reproductive histories exhibited through higher fertility problems, terminated pregnancies, miscarriages, or pregnancy complications.
There are many barriers to accessing safe and inclusive healthcare for these individuals, such as limited availability of LGBTQ and trans positive services, including educational resources, a lack of staff training, which can lead to things like misgendering and inappropriate use of language. There can be a lack of provider competency, which can result in patients having to educate their doctors and their healthcare providers. There's also structural barriers such as binary gendered washrooms, hetero and cis normative intake forms, signage, and also limitations with electronic medical records. And then people also face outright discrimination in healthcare settings.
Particularly when we're thinking about pregnancy and birth-related care, we know that that's a really intimate experience for people that they share of themselves, of their families and their relationships. And if they aren't going to be respected, then that's a reason they won't access our care. Further, I would say that for people who are queer, but also identify as Black or Indigenous, they obviously have other barriers that they may experience, such like racism, and we need to really be aware of those intersections as well for people.
I think it's really important to make people feel like you're not singling them out and to make them feel like they are not strange in some way. And so one thing that I try to do is explain to people that I'm going to ask you some questions now that I ask everyone, particularly if these are sensitive questions. So an example of that in my world is talking about sexual practices and sexual partners. These are very private questions. So how many sexual partners do you currently have? How many sexual partners have you had in the past? Some people might wonder, well, why is he asking me these questions? And so I say these are questions that I have to ask everybody before I ask them.
It's important for everyone to take their time to learn how to support people, but I think it's even more important to ensure that the community you're aiming to serve is representative within your space. And I guess that can apply to the healthcare level as well, you know. Take a moment to pause and look around the room and see who's in the room with you, and figure out how you can make changes in the community.
I think that one of the things that healthcare providers can do is really hold themselves accountable for their own learning process related to supporting the needs of queer communities. This might be through taking training and education. It might be by embedding themselves in community where they can talk openly about how to improve care and what's coming up for them around that. I also think it's really helpful for us to hold each other accountable and to model what we want to see in terms of the care for services that we offer.
At the organizational level, I think it involves multiple approaches. One is the training of staff at all levels, including registration staff, nursing, midwives, and physicians. Additionally, for organizations, it's important to develop organizational policies regarding the perinatal care of LGBTQ+ and gender diverse people, and also to direct resources to create affirming and inclusive spaces, both physical and electronic.
Trauma-informed care is important for everybody. It's important that when we're supporting someone, when we're holding space for someone, we understand and can acknowledge the ways that their lived experience, their past, their history, their story, their ghosts are in the room. And things can't always be a quick checklist because of the weight that someone can be holding that we can't see. And it's important to take time to slow down so that we can listen, to fully witness, and show up with respect in the ways that they need.
The other thing that's important to remember when we're specifically speaking about this population is that they have unfortunately been disproportionately affected by sexual trauma and sexual violence. And so we have to think about everything we do, things we say, and the way that we go about with examinations.
I think it's important because sadly, when we look at the history of mental health services and some psychiatric services for gender and minority people, there's been trauma that's happened from care providers and from how we tried to support people historically. And so this becomes a really important aspect to rebuilding trust with communities that have not necessarily felt safe accessing mental health services.
I think the most important thing for healthcare providers is to ask about identity and to make that a conversation that can start right at the beginning of their care journey with someone. So for instance, having it on your intake form that you are looking for their pronouns or chosen name, but also when they come in and address you, that you're also sharing your pronouns with them.
is to get really comfortable asking people about their sexual orientation, asking people how they want different body parts to be referred to, asking people how they want to be addressed in terms of names and pronouns, and just get into the groove of doing that for every client that comes through.
It reads that in advance of any physical exam, care providers must describe each step before and as it is being performed, allowing for opportunities to pause as needed. I really think this is so important as it sets an intentional goal to prevent stigmatization, alienation, or the re-traumatization of 2SLGBTQIA survivors who access care and support. As healthcare providers, we are in a trusting profession, but we have to earn our patients' trust. It is not instant and it is not assumed.
If I had to choose one, it would be learn, listen, and be respectful. I think that that's at the core of it all and relates to my understanding and my perspective of our roles or your role as a care provider. We're there to provide care and we're there to serve, and we should be doing this out of love. And the basis of love is respect, and we need to listen. And in order to fully listen and hold space, we have to be open to learning and unlearning what we know.